Hi, I'm Laura with J-Ray Laser. Today I'll be doing a video demonstrating how to use the two surgery kits that come with your J-Ray Laser. By the end of this video, you'll be confident in bringing this cutting-edge technology to your patients in your veterinary practice straight away. Before we begin, as with every time you use your J-Ray Laser, make sure you have on your safety goggles, that you, everyone in the room while using the J-Ray, and your patients are all protected. First, I'd like to explain the 3-meter, 600 micrometer surgical fiber kit. When you first open your surgical fiber kit, please be careful, as it is 3 meters of usable surgery fiber. Right now, as you can see, our therapy handpiece is connected. So we will want to disconnect the therapy handpiece. Make sure you replace the blue cover so the glass connector is always protected. Every time you put in a new connection, make sure you use the optical connector cleaner, simply by pressing on the bottom, exposing the cleaning tissue, wiping the glass connection a couple of times, making sure not to hit the metal edges, and inserting carefully into the connection. Next, we have to connect the foot pedal, which you will be using with both of your surgery kits. Make sure the red dot on the connector is facing up and simply insert it into the foot switch in the back of the machine. Next, we're going to be inserting the surgical fiber into the surgery handpiece. You're going to press down on the blue button and insert the fiber into the back. When about 1 centimeter is exposed, or however much you're comfortable with, let go of the blue button and it'll be securely in place. When your fiber is new or needs to be refreshed, you'll have to strip and score. This is your stripper and this is your scorer. Your scorer does look like a pen, so make sure not to mix that up with a regular pen. You're going to take the very end, about 1 centimeter, and give it a gentle but firm swipe across the end. If you've done this properly, you should simply be able to break off the tip. Make sure you put this straight away in the bin so as not to get in the paws or fingers of anyone in the room. To strip the plastic sheath that's on top of the fiber, you're going to need your stripper. Make sure that it's set at 2.2 and to whatever length you feel comfortable with. I use about 1 centimeter. Insert the fiber into the stripper, press down gently, and pull out. This will expose 1 centimeter of the fiber and the rest will be protected. Next, we're going to activate the surgical fiber tip. You're going to need a glass of water just in case, a wooden tongue depressor, and a very dark black Sharpie. We're going to put 5 to 6 ink blots onto the wood tongue depressor in order to activate our tip, which I'll demonstrate here in just 1 second. To activate our tip, we're going to go to Setup and make sure we're on Single Touch, which activates our foot pedal. To initiate the tip, simply go to the folder section, go to Laser Surgery Initiate, 2 watts, hit OK, and you will automatically be directed to the proper tip initiation setting. Press standby and you're ready to go. With the foot pedal, we will be pushing down on the foot pedal as we come down into the depressor. You'll be letting go of the foot pedal as you come up. We're going to be doing this 10 to 20 times to deposit carbon into the glass tip. You need to be very careful as you do this because, as you can see, it is actually starting a vaporizing action. So you're coming down with your foot at the same time as the surgery kit and up with your foot in the same time as you come up. You want to only do this in 1 second bursts as to not overheat your tip. Make sure to have your glass of water on standby. Give it a second in between to make sure that it cools down properly. You will feel the tip going in properly, just a little bit into the depressor each time. Activate into your depressor 10 to 20 times. You'll know that you've done this properly when on a white piece of paper you have a nice symmetrical round dot. Also, by simply going over the tip, it'll feel nice and smooth. If you aren't confident with your tip, or if you feel a bubble, you can always stop, rescore, restrip, and start again. After tip initiation, we have to go back into folders, and we have to choose the appropriate setting to do surgery. As you can see, they're pre-programmed in laser surgery at 5 watts, 8 watts, and 10 watts. It's advised that while you're still practicing to stay at a lower wattage and work your way up. When you're ready for surgery, hit 5, 8, or 10 watt, okay, and then you're automatically set up and ready to begin. Let's jump in and have some fun. This is what I call banana practice. Our first practice is going to simply be a straight line incision. So on your banana, you're going to start getting really comfortable just with the straight line incision. So again, down with our petal and making a straight line. You're only going to want to use the J-Ray fiber in short bursts until you get very comfortable with what you're doing. So down for 2 and up for 2. Down for 2 and up for 2. As you can see, we're on a very low 2-watt power right now, just so we can get comfortable. But as you'll see, an incision is beginning to get made into my banana. Short little bursts. Surgery is done in short little bursts. 1 second down, 1 second up. You're going to go over your surgical incision as many times as you need to break the top of the skin. This is great practice on your banana, and don't worry, as it gets easier and easier with your practice. So your first homework is going to be doing a surgical incision with your J-Ray in a straight line through the skin of the banana to the end. Your next homework is going to be tissue removal. With your tip, in 1 second little bursts, we're going to remove an entire piece of the banana. Down and up, down with the petal as you go in, and up as you come out. Down with the foot pedal in, and up as you come out. To start off with, just make sure you have patience, you give yourself some time, so you can learn this properly and get very, very comfortable. As you can see, we're still practicing at a very low wattage, so we can really get a hang of this. It's really fun and it comes very quickly. And if you can see my foot, it's going down and up, down and up, down and up. I fast forwarded just a little bit so you can see our last incisions, down and up, down and up. As we've gotten all the way through the peel, you can see how precise the J-Ray is in making incisions. The next homework is simply ablation. So try to find a banana with a flaw that you can use your J-Ray in and out, down with your in and release with your out on your foot pedal to completely remove the flaw in your banana. Down with the foot pedal as you go in, up as you come out. Short 1 second bursts as to not overheat the tip. The last homework, and the most time-consuming, but most rewarding when you're finished, is we're going to attempt to remove the entire tip of the banana. This will really help you with accuracy, patience, and precision. Again, 1 second bursts. We're in no rush. By this time, you should feel really confident with your skills to use surgery with your new surgical fiber kit. Next, let's put together and demonstrate how to use our therapy handpiece surgical kit. To reconnect our therapy handpiece, always remember to remove the blue protector and to again use our optical connector cleaner to clean the glass tip a couple times, making sure not to hit the metal edges before inserting into the side connector. Let's assemble our surgical handpiece. To do this, we're going to remove the therapy handpiece by unscrewing. Make sure you put that safely aside. Take out our surgical tip, removing the plastic covering carefully, and removing this surgical cap. You're going to insert, carefully put the tip over, making sure not to hit the fiber, and screw together. Next, we're going to just insert the surgery tip onto the therapy handpiece and connect. This surgery tip is pre-scored and pre-cut. However, we still have to activate it. So remember again, always wearing your protective goggles, glass of water just in case, your wooden tug depressor and Sharpie marker. We're going to activate the tip again on 2 watts with our J-Ray. Going to stand by. We're going to push the pedal of our foot pedal down to activate and let it go as we come up. We're going to activate this tip going straight in and out 10 to 20 times. Every so often, just have a little feel. Make sure that it's no bubbles, nice and smooth, with a nice in and out motion. You're activating that tip. As with our other surgery kit, we're going to do some banana practice. Doing the same practices, make an incision, remove a piece of peel, and removing the tip of the banana. Using our foot pedal, activating, turning it on as we press down, letting it up as we come up. Get a feel for both surgery kits, what you feel comfortable with. And hopefully by the end of these exercises, you'll feel confident and ready to begin surgery. Thanks so much.